According to the Congressional Budget Office and Joint Committee of Taxation, nearly 1.5 million people were enrolled in short-term health plans in 2022. But all of those people have to get new health insurance in 2025 thanks to new legislation passed by the Biden administration. Hi, I'm Larry Goist, owner of LMS Insurance Group, where we help people navigate the insurance maze. So in today's short video, I'm telling you guys about the finalized final rule that was announced on March 28, 2024, and how this is going to impact your health coverage. And in today's video, I'm going to go over 4 real basic topics. So number 1, I'm going to tell you what exactly are short-term health plans. Number 2, I'm going to tell you what kind of people have these plans. Thirdly, I'm going to tell you why the Biden administration is eliminating this type of coverage. And then fourthly, I'm going to give you my thoughts and my opinions on the whole ordeal. And that's all coming up next. Hey, before I dive in, don't forget to like our channel. Definitely subscribe if you find this content helpful. I really do appreciate you doing that. So what exactly are short-term medical plans? Well, these are the types of plans that you can purchase that they range anywhere from 1 month to 36 months. And these types of plans require medical underwriting. So when you apply for the coverage, the insurer can turn you down. They could say, no, we're not going to cover you. They could charge you more because of a pre-existing health condition, or they could just not cover pre-existing health conditions. And the states have different rules on how long these terms can run. Right now in Ohio, a short-term plan can run 12 consecutive months before you have to renew it and go through medical underwriting again. So under the Obama administration, they had finalized the rule that limited these plans to 90 days. And that took effect in 2017. So if you bought a short-term plan in 2017, it could not be longer than 3 months, 90 days. Well, fast forward a year later, and the Trump administration had basically unraveled that rule. And the Trump administration put it back to where you could buy a short-term plan, and it could be for up to 36 months. And then he gave the states the power to then determine if they wanted to limit coverage. So then in states in like Ohio, like I said, you could only purchase that short-term plan for 12 months. But there was other states where they allowed you to have a renewable 3-year short-term policy. So then Trump came in and established his final rule again and said, we're going back to you could purchase this short-term health insurance for longer than 3 months if that's what you want to do. So now 2024, on March 28th, the Biden administration comes out and says, well, we're unraveling what Trump did, and we're going back to where you could only get a short-term plan for 4 months, and it cannot be renewed. So here we stand now in 2024, and this rule starts on September 1st, 2024. So if you're purchasing a short-term health insurance plan after September 1st, the longest term that you're going to be able to set it for is 4 months. Now, part of this rule, the Biden administration, had said that the states are allowed to set stricter rules. So there might be states that still don't allow them. There might be states that say you could do it for 2 months, right? Anything up to that 4 months you could do, but states are allowed to come in and reduce the duration of short-term plans even less than 4 months if they choose to do so. Okay, so we know that short-term plans are now going to be limited to 4 months, but what type of people even have this type of coverage? So again, if you think about it, these plans don't cover pre-existing conditions. So the people that have short-term plans are generally pretty healthy. They don't really consider like blood pressure, cholesterol. They don't count those things as pre-existing conditions. So, people on short-term plans are people that they haven't had any major health issues, right? They're not diabetic. They haven't had a heart attack, stroke, cancer. They're not treated for COPD, emphysema. Generally, you have to be pretty healthy to qualify for a short-term plan. So the first thing you're going to see is that healthy people generally have these short-term plans. Now, I would say, you're going to see a lot of younger people in their 20s and 30s that have these types of plans. It's actually the type of coverage I carried on myself before I bought group insurance for LMS. So you think about me, I'm a 34-year-old male with no pre-existing conditions. I was able to buy a health insurance policy that was only $95 a month. Now, it had a $5,000 deductible, but my price was $95 a month. Now, because I can no longer purchase that short-term plan, I have to go to the marketplace, the ACA, the Affordable Care Act. And when I ran a quote for what I would pay on the ACA, it was going to be over $400 a month because I didn't qualify for a subsidy through the government. So that's your second group of people, right? One, healthy people, but two, people that don't qualify for a subsidy through the marketplace. So you get a subsidy through the marketplace based on your income. So if you are a middle to high income earner, you get no subsidy to pay for the plan. And then that marketplace plan is going to cost you $600, $700, $800 a month, depending on your age. So you have healthy people picking up short-term plans, and you have healthy people with middle to high incomes that these plans were very attractive to. I would think that the third group of people that I generally saw with these plans are people that retired early. So if you retired at 56 or 57, you had to make it all the way to 65 to get Medicare. And again, if your spouse was still working and you guys have a decent income, that marketplace plan for a 60-year-old with a high income is going to be astronomical. So the short-term plan was very attractive to them. You might be able to pay $300 or $400 a month for a short-term plan when you're 60, where if you had to go on the marketplace and got no subsidy, a marketplace plan would be over $1,000 if you didn't get a monthly subsidy. So you're going to have young people that are healthy. You're going to have healthy people that have high incomes. And then thirdly, you're going to have those early retirees who have high incomes. And that's the type of people that these plans were very attractive to. So why is the Biden administration limiting these to 4-month terms, in essence, eliminating short-term plans as a real health insurance option? Well, to quote what they had said in their press release, so the Biden-Harris, press release, they had said, "We are taking a major step to crack down on junk health insurance." So they are trying to make the case that these health insurance plans are junk. They don't cover you when you need the coverage, and they're basically saying they're misleading policies. So they think that people are buying these short-term health plans thinking that they are like real comprehensive plans that cover preventative services and that cover pre-existing conditions. So that's according to their press release. Now, I would say a second factor is probably because they are trying to get the people like me, the young, healthy people, they're trying to get us to pay into the marketplace. Because if all the 20 and 30-year-olds that are healthy aren't paying into the marketplace, that's going to drive the price up for everybody else. So by eliminating this option for health insurance, everybody in their 20s and 30s that was buying short-term plan now are forced to go to the marketplace because there's no other insurance to buy. If you don't work for an employer, if you're not a dependent on your parents' coverage, there is now no other insurance you can buy. Unless you have an LLC and you buy a group plan, if you're an individual, you now have to go to the marketplace. Like me, if I didn't have the group health insurance here, I would have to go to the marketplace. And at the end of the day, I think that's what the administration wants. They want everybody paying in to the marketplace. Now, in that press release, which I linked that in the description below, and I quote, the Biden administration said, "These junk insurance plans leave families surprised by thousands of dollars of bills." So they're making the case that people don't know what they're buying, and then they turn around and they get hit with these crazy bills because they didn't understand their insurance. And again, that's all in the press release, and that was a direct quote, which is in the article linked below. Okay, so what are my thoughts and opinions on this final rule? Well, first off, do I think that short-term plans are junk health insurance? Well, I personally have never had a bad experience. I have a lot of my good friends on these types of plans, and I've never heard complaints from them. I don't see it as junk insurance. I think if you don't have pre-existing health conditions, that the plan paid for what it was supposed to pay for. Now, I'm sure there's stories out there of people that got tricked or that didn't understand what they were buying. They may have bought in a plan with a pre-existing condition, and maybe they weren't completely forthright, and then they had a claim denied. I'm sure those situations exist. I'm sure that happens. But talking personal experience, I mean, I sold myself a short-term plan. So, no, I can't agree with the sentiment that they're junk plans, although there might be people out there that would disagree. So, personally, I think the real motive behind this is simple. If you can't buy a short-term plan, you have to go to the marketplace. The marketplace is the ACA, the Affordable Care Act, and that's what they want. That's what they've wanted since they've made the marketplace. They want everybody going to the marketplace and paying into it. So, personally, I think that's the bottom line. Are they really trying to look out for the people and avoid them for junk insurance plans? I highly doubt it. I really think the reality is that they are forcing people to the marketplace. That's how they want things to work. And now that's how things are going to work. We're going to go to the marketplace. And who knows, under another administration, they'll come in, they'll flip out the rules, and we'll go right back to where we were. Because if you followed the timeline of what's happened, these plans were legal and they were offered until the marketplace was created. And then the Obama administration limited them to 90 days. Then Trump got elected, and he went back to saying, no, you can buy these plans. And now under the Biden administration, we're right back to where we were in 2017, where you could no longer buy these plans. But for anybody watching this, a huge PSA, if you have a short-term plan, you need to get off of it and you need to go on the marketplace January 1st of 2025. Because if your short-term plan expires in 2025, you're not going to have a special enrollment period to get into a marketplace plan. So if you currently have this type of coverage, you need to do something between November 1st and December 15th. That is the Affordable Care Act open enrollment, where you need to get yourself on a plan for January 1st and cancel your short-term plan. Because if, say, your short-term plan expired June 1st of next year, you can't renew it. The longest you could renew it is 4 months. So if you want to get to the marketplace, the Affordable Care Act, you need to do that between November 1st and December 15th of this year. And if you need help with that, of course, yes, we do help people with marketplace plans at LMS Insurance Group. So I hope this video was helpful. Again, please like or share this if it was, because we really need to get this message to people as it's not being broadcasted. And I think there's going to be a lot of Americans that are caught off guard when they can't renew their short-term plan in 2025 and they have to go an entire year without coverage. So as always, thank you guys for watching. I'll talk to you next time. Larry Goist, LMS Insurance Group.